First of all, I would like to ask for your permission for both of you to use this video for educational purpose and on internet.
Sure.
Yes.
Thank you. So maybe first you tell me what were your symptoms before the surgery and for how long did you have them?
Well, I had terrible, excruciating sciatic leg nerve pain.
Okay,
Right
how
on the
long
left
did you have
leg
them?
into the toes, and that was 8 years.
I
Okay.
mean, tears to your eyes.
I mean, yeah, it was
Literally.
just, the kind of pain that would just take your breath away immediately, just out of the blue, and
Oh my.
yeah,
And you were managing it with pain management, with
Yeah.
narcotic and other pain management, and it didn't
Yeah.
help you, did it?
no,
Okay.
it didn't. It barely would take the edge off,
Yeah.
and me
No.
being a truck driver, you can't drive truck in with heavy narcotics of any kind.
Yeah.
No.
And many times our family suffers with us. What was your observation about his daily activity? How was he?
Before the surgery?
Before the surgery, yeah.
Yeah, there was some tears that came down. You could tell when he's in pain,
Yeah,
and he's got a high tolerance.
I know.
And, it would just take him down where I would think that I'd have to hold him up again because, how the pain just shot down the leg like
Yeah,
that.
yeah. Now,
So-
what was worse, the back pain or the leg pain? Then, before the surgery?
The leg pain.
The leg pain.
Leg pain, yeah.
Now, we did a surgery after we put you through everything, all the protocols and so on, and we decided all the other things are not helping you. We did the surgery when?
July 25th,
So about 4 weeks ago.
4 weeks.
So tell me, how long did you stay in the hospital?
I walked out that afternoon
Okay, so you,
into the vehicle.
okay.
Yeah,
How's the leg pain?
it's almost minimal to none.
Okay, so when
Yeah.
did the leg pain go away?
It's gone away, subsiding mostly probably about the 4th week.
Okay,
Yeah,
okay, so it obviously
So-
after the surgery is difficult for a while, but about around the 3-4 weeks after surgery you turned around.
yeah, yeah.
So overall, how is it generally right now? How's your daily activity? That's a question for both of you. How is your pain and generally daily activity?
It's completely, 180% difference. It's just turned the corner where,
Yeah,
there's life again and I can do things. And,
yeah,
I enjoy doing a little cooking in the mornings for her and making breakfast, and I couldn't even
mm,
do that before.
yeah. I
You
see
know,
that she
so-
enjoys your cooking.
Yeah.
So, yeah.
I mean,
So-
you'd be standing there for maybe
Yeah.
15 minutes, and then all of a sudden I
Yeah,
just
and-
see us
Yeah,
go
And
down,
I can't
and then you'd
get
have
to
to
the
go
point
sit
I
down
couldn't-
and not finish.
Couldn't do it.
yeah.
Yeah.
So-
And you told me as well, you feel that you're getting close to go back to your work.
Driving
and,
job, yeah.
And that is just few weeks after the surgery, which
Yeah.
is after open surgery, that would be pretty much impossible. But
Oh, yeah.
Right.
But I guess we did that minimal invasive L3 to 5 2-level fusion. The surgery took us literally 53 minutes, and our blood loss was a 2 spoonful. And you're right, we did it actually in the surgery center, and you
Yeah.
walked out of the surgery center a few hours later. You walked to your car, and I'm hoping she drove,
Oh,
but,
she did.
I drove.
but
Yeah.
you felt ready to go home.
Oh,
Yeah.
yeah,
So,
absolutely.
But now 4 weeks later, we're
Mhm.
from Iowa,
mhm.
and he drove up here this last time all on his own.
Excellent.
And that
excellent.
smile was on
Most
his
would.
face.
Yeah, yeah.
Yeah, get
He
some
got back in the seat.
independence
So,
back
so-
again.
yeah.
Now, still, we are going to ask you to be careful. Just use your common sense and
Mhm.
slowly add to the activity.
Oh, yeah.
And when you have pain, just as well look at the last few days, what activities could have provoked that. And generally, I think we see that the bone growth and fusion happens in our surgery, which is a minimal invasive olive procedure, within 4 to 6 months, whereas in open surgery, it takes at least twice or 3 times that amount
Yeah.
for the bone to grow.
Yeah.
But in that time frame, I think your body will give you the signals what's too much for you specifically.
Mhm.
And many of those activities are transition, going from one position to another.
Yeah.
And I think the rest of it is just the healing time and common sense, which you have pretty good
Yeah.
amount of.
Yeah.
So
Oh,
we
yeah.
should, we will be
He's,
okay.
Yeah.
he's,
Yeah.
he's cautious and listens to
Yeah.
Any other
Wow.
comments otherwise?
Well, just probably one. I mean, just a couple nights ago, there was a get together down in Cedar Rapids, and
Mhm.
Oh, yeah.
we didn't quite know what we were going to go to. It was an after dark hours for some
Mhm.
market things, and unbeknownst to me, after I looked,
Mhm.
I could tell that I was getting tired
Mhm.
of walking, but
Yeah.
the next day I looked at my phone, and here it told me I'd walk 2.5 miles.
Wow.
Yeah.
That's amazing.
Looking for a car.
Yeah. You
Well,
know,
I get tired when I walk
I-
2.5 miles.
Yeah.
I could hardly do 2 blocks.
Okay.
Yeah.
Well,
Before.
that is a
Yeah.
good news. That
Yeah.
and you are going the right direction. So,
Yeah.
and would you have waited another 8 years if you have something similar?
No,
to,
no,
Okay.
no way.
Well,
Oh, we
it's
did
8
that.
8 years.
Oh, yeah.
8 years lost.
Yeah.
Oh, yeah.
We don't want.
Yeah.
Yeah.
No.
And I think the
Yeah.
idea is that this surgery used to be so dangerous that we doctors would
Mhm.
make you wait that long before the surgery. But once
Yeah.
we reduce the risks and the result, we improve that to this extent.
Yeah.
There's no reason to wait 8 years and suffer and
No,
let the whole family suffer
no,
with you.
no. Yeah, exactly.
Well, thank you so much. I appreciate
you.
this interview.
Yeah.